All right, everybody, welcome back to the Barbell Therapy Podcast. I am your host, Dr. Brett Scott, and with me here today is Dr. Ryan Chow. Ryan is a physical therapist, strength coach, very similar background to myself, and has very similar viewpoints as me. He's the owner of Reload Physical Therapy in New York City, right? Mm-hmm. Yep. And he is someone that I've taken a couple courses with, or courses from, actually. And are you co-owner too of like First Principles of Movement? Or?
No, I help. I assist Craig in teaching it, but yeah.
Okay. So he's an instructor for First Principles of Movement with Craig Liebenson, who's another awesome rehab provider. Even though he's a chiropractor, he treats more like a physical therapist, it seems. So we let him go on that one. And then, just before we get started, I want to let everyone know that our podcast is sponsored by Ascent Protein. Ascent is one of the cleanest proteins you can find out there, with all natural ingredients. Everything is sourced from whole, real foods. And their creatine also is the most pure form you can find in the United States, which is all sourced from CreaPure. So if you'd like to get some or pick some up, we have some in the gym at Architect Fitness, or you can go online and use the code BSCOTT10. So no further ado, Ryan, let's get into it. So, kind of what was your background that led you down the path to being a physical therapist that just had the longevity aspect and training aspect in mind?
I wanted to just thank you for having me on here, Brett. It's always an honor to be able to talk shop with people who are making waves, changing the way things are done for the better. And so I just wanted to thank you there. But I actually started out as a trainer. I've been a trainer for 15 years. I became a physical therapist maybe 8 years ago. So even though I'm a physical therapist, I really identify more as a coach who happens to know about like injuries, pain, rehab, that kind of stuff. And my background is basically that, when I was a trainer, I was not fully into being a trainer. I was trying to become a physical therapist, but I studied exercise science, and it's the only job I can get. But it actually became like the biggest blessing in disguise, because the best physical therapy is really good training. So that's where my head's at. That's where I come from. I struggled a lot when I first became a physical therapist, because all the places where I worked, they just wanted to do like really easy exercises, like do massage for too long, waste people's time with like hot packs and like electric stim, when I didn't think it was going to make a big difference. And so, it was a big blessing in disguise. And now I try to help, blend the two together for people.
Yeah. And what year did you graduate PT school?
2017.
Okay. Yeah. So we came out at the same time. I was kind of the same way. I started as a trainer in undergrad when I was like 18 or 19, and then was like, and just learned a ton about exercise, which I think really made me that much better of a physical therapist. Because I don't know about you, the problem I see now is, and like your school experience was probably similar to mine, of like my exercise science classes, I think we had 2 labs that actually involved strength training. And then PT school, and one of them was student led, and it was like, yeah, here's a deadlift, and the girl was like, yeah, you pick the barbell off the floor. I was like, that's not a fucking deadlift. That's not how you deadlift. And then PT school was like the old school MET exercises of, okay, if you have rotator cuff tear, tendonitis, we just do 3 sets of 30 of banded external rotations, and, we might get to some cable rows if we're lucky, where there's a whole lot more to it than that. And
that was my experience. Well, in undergrad, I did exercise science, and all the stuff we did in school was just lab work. And I went to a great school as a big athletic program, University of Michigan, but we still didn't learn how to exercise. It's a science program, not a application program. And then at PT school is even worse. I don't even think I had 2 courses on it. I maybe had one hour, one lab day on it. And the problem with it is it's trying to teach you how to fix something. Like if you have a torn rotator cuff, let's say an infraspinatus, then you do external rotation because that's what the muscle does. So you fix that muscle, then you fix the problem. But the problem with that is the problem is much bigger than just one muscle. How did you end up with that in the first place? Mm-hmm. And so, I'm trying to think beyond that. I'm not just over the corrective exercise, but even like just getting stronger, fixing all problems. I don't think it works like that either. So I think it's so much more. It's a much bigger issue, a much more complex topic than I think we give it credit for.
Absolutely. And as far as that goes, like what are the problems you kind of see with like traditional PT or the way people think of it? Because like I think me and you are people that are trying to change what physical therapy is and looks like, and it's like mm-hmm. people say to me all the time, well, I tried physical therapy and it didn't work. It's like, well, like you might have gone to you went to McDonald's and that's a restaurant, but like it's very different from around here a big one is like the Capitol Grill or something that's very popular, it's fancy, expensive, high-end quality service. So yeah, what do you see going wrong in the field?
I think physical therapy, specifically physical therapy, not fitness, right?
Yeah, physical therapy.
I think in physical therapy, we are being cast as somebody who fixes pain when I don't think that's what we were originally trained to do, nor even if we were, I think it's a very complicated topic. That's it's not like a math problem. If this, then that. I always tell people that I've met 100 people with the exact same medical diagnosis. Let's say it's like a knee arthritis, but for the 100 people I worked with, every single one has a completely different plan. And what people are being sold is this idea is if you have this, then you do this to fix it. That's how the body works, and that's the only way it is. But I don't know if your training history is the same as the last person. I don't know how much time and resources you have to recovering from a type of workout. I don't know if your calf strength puts your knee in the same environment as someone else who does jumping all day. I don't know if that your sports history or lack of sports history changes how you would respond to this training. Like there's so many things that people aren't even thinking of outside of the exercises themselves that will determine whether something is going to work or not. And I think we're being asked to just make it simple, like simpler than it actually is. And so I think we end up getting trapped. People expect certain things and we can't deliver it in a 15-minute per patient model. Even me, we see people one-on-one for an hour, and we've been working with people I have clients that have been with me for 15 years, and it's still not that simple. Even then, you know what I mean?
Yep. Yeah, it's funny. Actually, the other day I had a patient that, I had 2 patients back to back. They were both gym members. And they both got hurt outside of the gym, and they both had a lateral LCL strain or tear, and they both were like possible tears. They were very mobile in that segment, and they saw each other after because they were both go to the gym after PT, and they're like, oh, like so we'll like do all the same exercises and this and that. I was like, no, it's like why not? I was like, well, you're 2 different people. You do 2 different things. You're different ages. Like you were very stiff and the other person is very mobile and like doesn't need to stretch anything at all. They need to be way more stable. And he's like, oh, he's like, so we're not going to do any of the same exercises. Like there might be some overlap, but like not really that much. And he was like, oh, that's weird. I was like, not really. Like everyone, yeah, has to have their own treatment plan. But
yeah, otherwise Google or Chat GPT would have figured it out already, and then we wouldn't have any of these problems. Yet people don't recognize that musculoskeletal pain is like one of the hugest driver of medical costs because we don't do a good job of fixing it. And even something like weight loss, if you just go to the gym side of it, right? It's simple in that calories in, calories out, it determines the outcome. But what goes into calories in, calories out is related to lifestyle, beliefs, like access, how you deal with stress, how much time do you have, and it's simple, but if it was easy and you could just do this, then we wouldn't have 50% of the population being overweight or obese in this country, would we?
Yeah, no, we would not. And on the topic with the getting people to live a healthier lifestyle, how do you guys go about that on your end of, someone comes in with pain and injury? Granted, they're probably more of an active population that's coming to you anyways, but what types of things are you guys doing that are different from most people? And like, I just want to get a sense from my own, perspective on what you guys do to really incorporate and look at not just this injury, but what the long game looks like for this person.
Yeah, that's a great question. I think this is what we were teaching in the course back then, but we take 2 hours to sit down and get to really understand each individual and every single factor that's involved in their story. So we let people tell us about, their problem, and then we ask about the history of it, and then we learn about all the things that are influencing it, or whether they understand how it's influencing it or not. We just hear everything about their story. Then every single thing we look at after that is in relation to everything they're telling us. So we take the time to learn about psychological factors, social constraints, their specific goals, their specific history, certain things that they worry about or care about, things they have access to, they don't have access to. And that helps us maybe nail down, like, maybe there's 5 factors that are leading up to this, or there's this maybe idea or belief that, I have to do things a certain way in order to get the outcome, and maybe they're too married to an idea that like something that's common, like powerlifters want to lift heavy all the time. I'm sure you see this, and there's other ways to get the bar to put more weight on the bar. You don't have to just add more weight on the bar. You can move a lighter weight faster. You can do a completely different exercise and it can still strengthen the parts of your body or the biomotor qualities of your body that will carry over to lifting a heavier bar without just doing the same thing over and over again. And so we address beliefs, we address behaviors, and we bring a lot of awareness to, like, people. A lot of times people have like a hunch that, like, this is related, but no one ever really listens to them long enough to confirm or deny or validate those experiences and their instincts or what they believe. And most doctors, physical therapists, trainers want to say, like, yeah, that doesn't matter, like, just do things my way and it'll work. But instead, we don't really do that. We just try to listen to what they think is going on and what things make sense to them, and then we test it with them. We give them a safe starting place. We test their theories. We show them how that might work, have them try it, and we help them analyze the results and the outcomes. We always tell people the initial program isn't the most valuable thing we give people. It's interpreting how your body's responding, and then how we adjust to it is what's most important. And that way we can rule in or rule out whether sleep is the issue, or the type of exercise, or your technique, or that modality, or how often you're playing your game, sports activity, or whatever it is. Like, those things are all factors, right?
Now, will you test, if someone has like a false belief about something, will you do things to prove them wrong too? And be like, you think it's this, and then, you have them do a movement or similar movement to what they think is causing the pain, and it's not the issue? Yeah,
well, we're going to test out their theory one way or another, not to prove someone wrong. You know what I'm saying? Like, if what they're thinking is true, maybe they just don't have the words to explain it the way they mean it, right? And then we might investigate what they're saying and say, that makes sense. This is what we think. Or like, that helped a little, but it's not the whole story. So maybe that'll get you 10% better, but maybe 10% is going to get better from you cutting out this HIIT class, so that way you have more energy and less wear on your joints. That's not necessarily moving the needle. It's good for you in general, but in your specific case, with your specific needs, with your specific hurdles today, maybe that's not the most efficient way to get there. Maybe it's actually holding you back. Maybe something that was helping you get to where you are today is no longer helping you. And so we're not, we're not trying to be just more right than everybody else. We want to actually be supportive of a person's overall goals. So, we're going to validate what we think is helpful, but we're still going to try to co-create a plan with someone that involves what they want. And if we don't believe something's to be true, we'll prove it to them and prove it to us, because we don't know for sure,
Mm-hmm. That makes sense. Yeah, it's like I had the other day, I had a girl that came in and she was like, I hurt my back deadlifting last week. I was like, okay, like, when did it start hurting? She was like late Wednesday night, like before I got to bed. I was like, okay, well, when did you deadlift? Monday. I was like, okay. And what happened like later in the week? She's like, well, it got worse on, it was about there on Thursday, I think. And then Friday it got real bad. I was like, okay, so you think deadlifts on Monday was giving you severe back pain by Friday? I was like, what did your week look like? What things had happened? And she works for herself and she's very busy. And she's like, oh yeah, I was actually sitting at my desk like 15 hours a day, says my Apple Watch, which is like fairly objective data. And I was like, oh, okay. And how's your stress right now? And I know she has some personal things going on. She's like, yeah, my stress is really high. I was like, okay. And, her sleep wasn't that good. And I was like, yeah, I don't think we can blame the deadlift on this one.
But Brett, obviously, I obviously agree with you, but I also think that's a product of clients and patients only knowing to blame what they've heard from other people, and they never thought that stress is related to pain, and so they don't throw that out there as a theory because they've heard of other people getting hurt from deadlifts, which definitely happens, although obviously you and I know it's more related to like how are you programming it and how are you recovering, and it's not necessarily that that's a bad thing for people. It's actually a necessary thing for people, but they don't know what else to blame. Every time I ask people to come back to do a follow-up, they're like, yeah, that's great. I would love to see you next week so you can work on my technique. And meanwhile, I never coached their technique the entire time, because they think that that's what we do. So they tell us, what they really meant was like, I appreciated your guidance and I want to continue to make progress. But I just say the words technique because that's all I understand about what you really do, not realizing that I've been helping them uncover how stress is related to recovery. And if you stress the body, you don't recover, you don't actually get better, and teaching them about how their body works. And so they just offer what they know. And, sometimes it's frustrating, but when I take that viewpoint, I find that it's much easier to work with people because I'm sure if they knew better, they would speak about it that way. You know what I mean?
What is a way you get people to realize their stress is related to their pain and suffering?
We'll talk about it just the way you kind of outlined. They're like, oh, this started 6 months ago. I was like, oh, this is the first time that happened? They're like, no, I mean, I've had 5 years ago, I had a really bad thing. My back was really bad back then too. I was like, oh, what was going on 6 months ago? And they're like, oh, I was going through, a tough time with my kids or something. I was like, oh, what happened 5 years ago? They're like, oh, is there anything special going on? It's like, no, nothing. I was just between jobs. I'm like, oh, so those were both very stressful times in your life. They're like, oh, I guess so. I'm like, oh, by the way, did you know that there's, this is how stress recovery adaptation works. Here are some studies that talk about how job dissatisfaction is more related to back pain than your strength is, or your core stability, or whatever people think it's related to. And so I always pull from their experiences. I never lead with the studies. I always lead with their story. And if I don't let them tell their story, then I'm jumping to conclusions. And they go, oh, you don't know me. You don't understand my life. But if it comes from them and I just help them make sense of their experience, and then we talk about signs of readiness, We talk about things like in the performance world, like if I set a new, jump height record, if I asked you to do that every single day, do you expect to be able to do that? They're like, no, I'm going to be a little tired from the day before. I'm like, okay, so how is that different than this? Like if you're a little too tired and I force you to pick this up, don't you think you might stress your back more than the unintended stress into the joints or the nerves instead of like the muscles that you didn't really mean? They're like, oh yeah, that makes sense. I'm like, cool. Is that possible that maybe happened to you? Like, oh, that actually makes a lot of sense.
Mm-hmm.
You know what I mean?
Yep, that's a good one. Yeah. Do you have any like more specific stats too? Because I'd just be curious, like what stats and things you give people about, related to stress and injury. Because I think these are things people need to hear more. Like one of the ones I throw out there all the time is that I'm like, yeah, stress is very much related to, pain and injury, because we see in NCAA players that their rate of injury doubles during finals and midterms. Yeah. And everyone gets sick the week after finals or midterms.
Yeah.
Once you gotten.
Yeah, I mean, there's a lot of ideas that we unpack with people. I don't know if they're very specific stats, but like, let's say, for example, like a lot of people get told like, oh, my hamstrings are tight, so I think that's why my back hurts. There's no correlation between that, like core stability, like, oh, I'm not strong enough. Like none of those things have been shown to be very strongly correlated. And we know that like 80% of people in one study are estimated to have like severe back pain at one point in their life. But we don't know the cause. No, there's no strong correlation for cause for back pain. And the reason why that's confusing is because we want a simple cause or just do this. If this is the problem, then just do this. And if you're someone who studies all the research, it's basically telling you, no one research study can tell you this, but reading all the research studies tells you this. Everybody's cause for their pain is different. And so it could be related to so many different things. And so what I like to think of is we just have to figure out what that means for you. Now, all of a sudden, everything is a possibility. And sometimes that feels overwhelming. But another way to think about it is if 10% is from your mobility of your hamstrings, 5% of it is from like the strength of your hamstrings, and then like 20% of it is like your crappy training program where in the urgency to get stronger, you're doing too much too soon, or another 20% of it is just the fact that like you're working more than usual, and then now what seems to be overwhelming is now like, oh, if I make small changes in 5 different departments and I don't have to do anything crazy like get a surgery or like change my whole lifestyle, then all of a sudden this actually becomes a much better approach or lasting approach, because everything kind of made me feel better for like 5 days, but nothing really has made me feel like it's gone. Mm-hmm. You know what I mean?
Yep. Makes
so
a whole lot of sense.
Like I do know stats, but I don't think people realize like of the 80% of people who have that debilitating back pain, like almost 60% of those people, it'll come back, like in a year or so. Every year or so it comes back. It's kind of like the common cold. Every year during like the cold season, people expect to get, start coughing, sneezing, and have to stay home. We don't always think we're like dying of the flu. We just look at it and say, oh, I'm fine. I don't have to get fixed. I just have to modify for a few days and then it'll pass. And then I'll go back about my life. And the reason why that doesn't happen for back pain is, we catastrophize it. We pathologize something that is in the research. Usually it'll get better in like 6 to 8 weeks without doing anything, whether you see the PT or the trainer or you don't. And in more severe cases, even with sciatica and the nerve root symptoms, it'll get better in 8-9 months without doing anything, whether you see someone or not, whether you get medical attention or not. And so if we take the approach of modify in the short term but live your life, it's not dangerous, it's not scary if we rule out tumors and fractures and infections, and we just tell you it's safe to continue moving and just modify in the short term and it'll be fine, it actually doesn't really affect people that much. But we don't tell people that. We put K-tape on them and say, careful with this. You know what I mean? Like, that's not, and people that we wonder why people don't want to come back to PT. They're like, they just keep telling me to do the same 5 crappy exercises, and I don't think it makes me feel better, so I don't want to go.
Yeah. The cookie cutter programs we love to see in mill type clinics. I had a friend that he just tore his Achilles, and he was a prior patient. He just came back today, but he financially struggled, whatever. So I was like, yeah, you can go to this clinic down the street, and they're pretty good. And he's about 5 months out, and he came back. He's like, yeah, I'm ready to come back to this. Like, I knew you would at some point. And he's like, yeah. He's like, nothing's challenging me at this point. It's like all the same exercises they give me. They give me this like light massage. They put me on ice. He's like, I could do that at home. I was like, yeah, you could do that at home. Like, and at this point, you're 6 months out. Like, I don't think you need ice anymore, pal.
Yeah. I mean, listen, you're describing this world where physical therapists, we go to school, we learn all this stuff, and then in theory, the way they teach us in school is like you do your research, you learn new things, and then you apply it. But in practice, what are we actually being asked to do? We're asked to see people for 8 weeks, twice a week. We don't know what happens to them afterwards, because if insurance doesn't cover it, people don't want to pay for it. And we expect a physical therapist to know what a 10-month, 15-month rehab is supposed to look like. Like, they've never seen what happens after that. So why would they know how to problem solve in those situations? In fact, in order to problem solve, you have to see what happens, read and respond. But if you have 15 minutes with a patient, you don't know what's going on. It's not enough time to hear stuff, give feedback, teach, see how the body's responding, and adjust accordingly. And so they never develop those skills after school. They just keep reinforcing useless skills. And we wonder why people don't want to spend, now with Google and YouTube, like if you get a set of exercises as a client or a patient that you're going to get from ChatGPT, then of course I'm not going to want to go to the physical therapist. Like, what's the point of that? And so we give people plans and strategies, not workout programs. Like we always say our motto is it's more than a workout. If you're just getting a workout, that's a dime a dozen. That's easily replaceable. But we want to provide a more holistic, full picture and plan, long-term plan, and so that's why we talk about everything.
That's interesting. So, when you say plans and strategies, like what types of things are you giving patients?
So we always think about the physical activity guidelines as our hack. Right? It's our cheat code. Our cheat code is if you do twice a week progressive resistance training and 75 to 150 minutes of vigorous aerobic exercise intensity, or 150 plus minutes of moderate aerobic activity and reducing sedentary time, that takes care of almost everybody's health concerns, whether it's musculoskeletal pain and injuries. Of course, in those cases, we would modify those exercises that would respect the pain and the injury that they have, but still, trying to hit those numbers. Cardiovascular disease, which is the number one killer in the country. This also helps with cancer risk development, and it helps with preventing relapse if you've had it already. Dementia, Alzheimer's, Parkinson's is reduction of risk doing this. Falls, frailties, and fractures, osteoporosis, all that stuff is addressed by doing this. These things are all stronger than most of the meds that people are giving. High blood pressure, atherosclerosis, you name it. Like, if you want to invest in something, that's your best bet. I think his name is Robert Butler. He was a healthy aging physician from Columbia University. I think there was an aging center that he ran, and he said if exercise could be packaged in the pill, it would be the most effective medicine sold, and one that everybody would want. But unfortunately, you can't replace what the body needs to do naturally to maintain itself. And so everything that we give people is through that lens, and then in trying to impart that on people, barriers come up. Oh, I don't have time for that. Or like, I'm not ready to do that much yet. Okay, cool. Let's start with this, see how your body responds. And then we'll bump it up to this over 4 weeks. Oh, well, how do I put my cardio days next to my strength days if I feel this soreness? Okay, let's problem solve that for you. For you, one person might use a ski erg, another person who's had a labral tear might do a rower. I don't know. It's everybody is different, and through those conversations, we call it like fitness forward or physical activity forward rehab or training. The stories of the problems about stress or diet or nutrition, those limiters come to the forefront, and then those become the vehicle in which we start to talk to them about those things. And I'm not saying that we're experts at all those things, but if we need to refer out, we'll refer it out. But it comes to light that might be a limiting factor.
Do you feel like too you're almost more of a primary care for a lot of these people than their primary care is? Because that's how I'm starting to feel these days.
Absolutely, 100%. Now I don't think I am fully equipped to be a primary care physician.
Not at all.
I'm not saying that you're positioning yourself that way, but we have to play that role, because when people come in after they've seen the primary care physician and they did correctly identify what needs to be done, I always ask them, like, that's great. Like, I'm down to do that. Now, but what's the plan? They said, plan? What plan? They just told me what's wrong with me. Like, they didn't tell me what I'm supposed to be doing, right? The extent of what I'm supposed to be doing is like, this is bad for me, and I need to take this medicine. The rest, you have to figure out on your own. They're like, oh, you got to cope with stress better. You got to move more. Like, what does that mean? That's too broad. And so we think of ourselves as in the trenches, help you take action. Like, I hate all these, everyone like selling these ultra expensive, like testing on VO2 max and looking at your genetics and finding all these things that are wrong with you and that you need to do better, but no one actually wants to help anyone do anything about it. Yeah. And so that's what we do. We sit there day in and day out and talk you through, walk you through, show you, help you interpret, help you understand all those things so that you don't feel like you're navigating this without any sort of expertise and guidance. And so, yeah, we work on a lot of different types of things with people, but we are still like, training in rehab and musculoskeletal forward.
Yeah. Yeah, I'm just going to vent about primary cares for a minute here. I have a patient now and it's such a sad story almost, because she came in not trusting the medical system because her husband had a bunch of stuff going on and no one was able to figure out what was going on with him. And I took one look at her. I was like, you definitely need 2 hip replacements. And I am very conservative when it comes to surgery. I'm not one, like, I want to go through every measure and make sure, like, we want to try to prevent surgery as much as we can. I was like, I've seen plenty of people that needed hip replacements. I've rehabbed plenty of pre-op, post-op hips. You need hip replacements. Like, there's just no getting around it. And we tried, since she was like, no, I was like, okay, we can try. And we did months and months. And it was months and months of me convincing her to go to the doctors just to get an x-ray. And finally, after 8 months, she did. And she had to get a new primary care, and the primary care said, I don't think this is joint related. I think this is muscular, and I want you to go on an antihistamine diet. And was reluctant to order her an x-ray. They got her an x-ray. The results came back. She has an impacted, the acetabular roof was raised she fell. And so it was like the whole acetabulum was, contorted. And on one side and the other side had, brutal joint space diminished and everything. She went to see the hip surgeon, and the surgeon just wrote on the thing, frankly, the degeneration in this hip is catastrophic. Yet this PCP was telling her, it's not joint related. Take a muscle relaxer. And then, to top it all off, she went and they're like, yep, you need both of these hips done like as soon as possible. Her PCP had done her blood work before, and then her hematocrit and hemoglobin were half of what they should be. Like they were like 6 and 24. which is really low. When the hospital that's doing the surgery got it, they called her like, "Are you symptomatic? Are you in the hospital right now?" She was like, "No, I'm fine." They're like, "You need a blood transfusion immediately." And so now the PCP not only told her the wrong information, didn't do anything about the labs, and then now she has to postpone the surgery because she needs to do iron and blood transfusions to just be at a healthy enough level to have a surgery where she has oxygenated blood in her body. And it's like, well, that backfired on us because now she doesn't trust the medical system any more than she did before. And I feel like more of what we do is like, I go to patient visits all the time with people because they just get run around or they're not listened to or they're gaslit by their physicians on what's going on. It's a brutal world.
Yeah. Everyone's seen all these horror stories. And while I get frustrated when I hear about those things, we hear about those things a lot too. I also empathize with the physician because they're in this impossible situation where they have to they have to make these decisions in like 5-10 minute visits because they're being pressured to see 40 patients a day because they've been in school for like 35 years and then now they're like, as an adult, like finally making a livable wage. Like the only way to make the livable wage is to go through this system where they have to see 40 patients. And how are you supposed to critically think and gather all the information in such a short amount of time? You can't. It's impossible. And so they try to reduce everyone's experience down to like a test or like a 5-minute conversation. And that's kind of what I was talking about. Like, yeah, you got to listen to the person. You got to hear the whole story. You got to dive into the details. You got to see how things change over time. And the funny thing is they teach us all that stuff in school, but nobody does it because nobody has time. And, so I know you understand that. But this is kind of also what I tell myself. So I don't like get so frustrated all the time, And most physical therapists, you ask them, like, why do you want to become a physical therapist? A lot of them say, I get to see patients often enough to make lasting changes. And so, I know that was what a big thing was for me. But then when I was a trainer, I was really personal with people over long periods of times. I'm like, wow, a lot of physical therapists have never had a patient for 15 years, right? Like, you never really get to see what all this is and really know them so well. I have patients who stay with me right now who are like very healthy and they're doing great, and then they keep coming in. I said, why do you keep coming in? They're like, well, I know that they learn from me because I always tell them like nobody lives a pain-free life. Like we don't tell people you're going to be pain-free, we're going to fix your pain, because no one in this earth has ever lived a pain-free life, so why would I promise that? And so they go, well, what I do, how hard I work or how hard I don't work, what things are like when I'm good. So if anything goes wrong, exactly where I was and how to get me back there. And I was like, oh wow, you're pretty smart. Like I thought I was trying to get you healthier, but you have this idea that the starting point that you have when you get injured, whether it's a really bad injury or even a smaller like ache or pain, where you should start working with someone isn't only dictated by the pain, but your fitness or your level of training in the last 6-8 weeks is really what you have, who you are now. And if I want to be very, very specific, like if you think of the physician's like very poor ability to get nuanced and be specific, take that to another level and then another level and another level, and I know exactly what this person can do. So like if they're usually, let's say, I'm just making it up, like squatting 200 pounds and then all of a sudden their knee hurts, and then like I put 100 pounds on the bar and they're like, oh no, he's just gonna hurt me. I'm like, this is definitely not gonna hurt you because you did this last week. Like I know it hurts, but like it's not, I know this is well below what your norm is. Whereas a physical therapist who doesn't know them is going to start them with like, here, do some bridges and like, do some calf raises. I'm like, no, I'm gonna skip ahead because I know you. You know what I mean? And that's valuable. In New York, like people don't have time to waste. Nobody wants to see me. Like nobody wants to see me. You know what I mean?
Yeah, busy lifestyle out there for sure.
Yeah. But that's like a thing that nobody talks about. Like I'm saving you time. Like you can do the guesswork, but like you need to get back on the horse. Like everyone's under pressure with like nowadays, like everyone's got to work 1,000,000 hours. Nobody makes enough money. Like nobody has time to waste with this. So there's something to be said about being more efficient, you know?
Yeah. Yeah. The thing is, it's not the physicians or anything. It's the model we have. And it's tough because, they have like 7 to 15 minutes with someone. But the tough part is a lot of times the physician can be making their best effort to give someone information or education or their thoughts on something, but they don't have the time to even communicate that effectively. And then when that doesn't get communicated effectively, this person goes home and Googles it, they catastrophize about it, and then they come to us, and we're the musculoskeletal experts that have 7 years of training in this when the physician might have had 8 days worth of training on orthopedics. And it's like, yeah, you know what? I know your physician told you this, but now we have to look at the whole big picture. And it took me an hour and a half to figure out what the root of this is. Yeah. And like, this is our training. And like, this is why all of this doesn't make sense. Does that make sense to you? And it's like,
I love it.
Yeah. It's like, okay. And then go listen to this podcast where we talk about the same thing just to reinforce that idea.
That's what this is about, huh?
Sometimes, yeah, man. I use this a lot of like whether it be this or like pelvic floor stuff. I'm like, you get all kinds of stuff going on, and it's like, I can't mechanically reproduce this. You mentioned some symptoms. I'm like, hey, go listen to this podcast. I did this pelvic floor provider. The homework step number 1 is do that. And like identify if there's anything here that really resonates you, of something you're struggling with or dealing with, and then let's talk about that more. And a lot of times people will come and like, oh yeah, like that makes sense. Now,
yeah, that's smart. That's smart. You're giving people resources, right?
Exactly.
Letting them discover stuff on their own, so you don't have to you're not it doesn't feel like you're attacking them.
Yeah, exactly. And then what? Zone 2 cardio is the big thing I've been getting more into myself recently, and there's a lot of data coming out on it. Mm-hmm. People don't want to necessarily buy into it because they don't like it, but can you discuss any of the benefit? I know we mentioned jogging and things, or moderate intensity cardio. Does Zone 2 fall in there? Do you know?
Yeah, it's complicated, but yes, it is. It depends on like whose scales and verbiage you're talking about, but Zone 2 is a key component of those physical activity guidelines, and it's important from the standpoint of like we want to recognize that doing lots of easy work is a key piece of a healthy situation, a healthy lifestyle, because it's simultaneously like a hot thing that's very important, and also like oversold as like the next best greatest thing. You know what I mean? Like depending on what circles you're in, but the general idea is if you want to like be healthy, your body has to be able to do a lot of easy work. That's to keep it very, very layman's, like not getting into like, oh, it's like, going for a fast walk, or like, because some people, even an easy jog will spike their heart rate too much if they haven't done it lately. And so I don't even want to say easy jog, but yeah, it's about doing a lot of easy work. And it's very important to maintain mitochondrial health, cardiovascular health, just metabolic health, mental health. Like there's so many things that it checks the box. And I think the only reason why it's popular right now is, well, there's two things, but I think one is that like most fitness is services are sold on like trying to make you feel the perceived benefit. So like if you get endorphins, or you're really sweaty, or you feel the burn, like you feel like you're getting out of it, so you'll come back. But like Zone 2, you don't necessarily get that. And so people don't really give it to people because they just want to...
It's not sexy.
Yeah, it's not sexy and it's hard to sell. So, they say, well, I don't care about your health. Like, I'm just trying to sell you stuff. So that's how I feel it is. Like, but, that's why we sit there and we do the work with people. And we will struggle with people if we think it's very important. Like, we will go through the very difficult process of making it important to someone, even though it's not sexy, even though everyone else is like giving them something that's more fun. Because if we really think it's helpful and like you're at risk for like a heart attack or obesity or whatever, like I'm not trying to be sexy. I'm trying to save your life, like so yeah. What do you want to know about it? Like what can I help share?
I think you kind of just put the nail on the head. I think Zone 2 is funny too, because it used to be like before we probably started exercise phys school in 2010. It was like in the bodybuilding world, it was like, yeah, Zone 2 to like, because you want to be in that fat burning zone. Zone 2 was like kind of the fat burning zone, I believe, where it was like, per minute, per watt on the treadmill or whatever, you were burning more fats than carbohydrates. But then as soon as you get off, it doesn't really matter. And that whole equation doesn't really equate to much or transfer into reality practically. But then, and then we went to, and then everything was, when we were in school, and I actually did my thesis on high intensity interval training and calorie burning and metabolism and all that. And yes, high intensity training can spike your metabolism more significantly in a shorter amount of time than steady state cardio can. And I was like, oh, everyone, high intensity interval training was the craze. But we forgot about all the actual like health benefits of Zone 2. And now the past couple of years, it seems like it's like, oh, actually, like, let's not forget about Zone 2 because, yeah, it's not sexy, but it's really healthy for you. And even like from a training standpoint, I'm trying to get more and more people to do it because I've noticed the benefits of doing it, of just like, I'm recovered more, I sleep better, my rest in between sets, I'm not gassed as much with my training. It makes a hell of a difference for all of that. And even I've seen a lot of my CrossFitters that came to the dark side of Olympic weightlifting with me, that when they were still doing both and couldn't decide, they were really good. And then they're like, oh, I'm going to go down to 2, from 5 days a week to CrossFit to 4 to 3 to 2 to 0. And then it's like, your performance plateaued. What's the difference here? I was like, well, what did you leave off doing? I was like, well, I was doing 2 days and I was just doing like kind of moderate intensity WODs for like, 25 to 40 minutes or so. It was like, let's maybe go back to that. CrossFit ain't bad when it's programmed the right way. And
I agree.
And when they put the stuff back in, it's like, oh. And I don't know about you, like when I lift heavy, like if I'm only lifting heavy, I feel like my body just like there's no blood flow to it. Like my tendons get like firmer and stiffer. I have ankylosing spondylitis too, so I think it helps me just move and lubricate my joints better. But for me, it makes a total difference of like I just get really stale if I train in the red too long and in the high intensity zone with from like a 1 rep max intensity perspective.
Yeah, I mean, you touched on a lot of great points, and I'm actually a bit older than you because I finished PT school late because I started late. But no, I studied like VO2 max in the lab in undergrad. McCardle and Catch, like I studied all the textbooks and I did all those things. And back then I was like, this is the silliest thing. But I think like all the Peter Attia, like, health span, longevity stuff, and the correlation between VO2 max and living longer is part of why it's sexy. But to your point, it's to a bodybuilder, it's burning fat without, so you can have a better body comp. To someone with heart disease, it's about making your heart stronger. To someone who wants to do high intensity training, it's about recoverability, so you can do more frequent or higher intensity workouts and recover from them. The reality is the physiology of the body is the physiology. Whose perspective it is and what their goals are is specific to them. But that's kind of what I mean. Like, if you want to be a real expert, like in terms of training someone, not only do you have to understand that for each person, it's valuable for all of them, you have to understand that the only way you get to that point, though, I think, is if you actually get to know the person. And, you know, I can tell two different people who both need to do zone 2, but if I tell the bodybuilder that this is, you know, for high intensity training, they're not going to care. And if I tell someone who has a heart disease that, like, this makes your recoverability better, like, they're not going to care. In other words, it's applicable to all, and it's universal, and I think that's why we should be discussing it. But, you know, somebody who's into longevity and health span goes, oh, this is the number one correlation, so that's all I'm going to invest in, doesn't understand that, like, you can have the greatest VO2 max, but if you fall and break your hip because you can barely carry your own bones around, like, that's not going to, you know, what I'm trying to get at is that everybody's trying to oversimplify and boil things down to one thing. But that's why I said the hack is the physical activity guidelines. It's all of the above. It's not just the parts that you like. We know powerlifters want to train heavy and they hate doing cardio. We know, you know, that people who run races don't want to lift, but that's where we help center people, right? It's like, I don't need you to be an expert at this, but I just need you to have a little bit, and it'll make your life a little better. You know what I mean? Like,
yeah.
And we'll take from their experiences, like your example about like how your joints feel. You know, I hate cardio, and but I do it now because, but it's because, you know, when I was lifting and I was younger and I was fitter, I could get away with doing high intensity stuff pretty regularly and feel good. If I lift heavy nowadays, it takes me like 7 days to recover because I haven't, like, my joints will be aching for like 3 days because I don't have a cardio base anymore because I haven't done it in a while, like regularly to build up a base. And once I build it, it's so much easier to maintain. I might have to invest 6 months to get it there, but the rate at which you lose it, if you do it periodically, is very, very, very little. Just like, you know, with strength training, like back when I was lifting, you know, I got my deadlift up to like 465, and I haven't lifted heavy in like 4 years. But the other day I walked up to a bar, 335, no warm bar, you know, no problem. Just repped it out for a few. You know, because strength stays with you. Just like your cardio stays with you if you build it up. But if you've never built it up, then that's such low-hanging fruit that'll make everything better. And you should, you know, and that's where we're trying to get people. We're not trying to make people into like endurance athletes and power lifters. Like, I went through it so I can learn it and understand it so I can help other people with it. But like, I'm not asking people to do that. Like, that's crazy. Nobody cares about that. They just want to, you know, well, some people care about it, but you know what I'm saying.
Have you ever signed up for like a long distance race at all?
No. I can't do it, man. Like, I'm not interested in that at all.
So I never thought I would be either, and then last year I slowly got it. I slowly got into running last year, because I had hurt my hip weightlifting and I couldn't really do much, and I was like, you know, I kind of need to change the pace. I've been doing this. I've been living in the gym for 15 years now, and I wanted to lose some weight, and I actually did some genetic testing that showed like for me to lose weight, I need to do cardio, which sucks. But I was like, well, if this is the hand I'm dealt, then this is what I'm gonna do. So I started, like, I couldn't run like 3 minutes, and I was like, all right, 3 minutes on, a minute off, you know, 5 minutes on, 7, 10, 15, 20, 25, 30. I got to 30. And then one day I actually, but I was seeing progress, and I was like, okay, like, it was getting easier to do, and I was just doing it twice a week. And I wasn't like trying to race or anything. And then I was actually hungover in Florida with my family for Christmas, and I went out for a run one day. My Whoop said I was at 1%, and I went, and then I was like, I'm probably gonna run like 3 blocks and come back. And I was like, it was just nice weather. We live in New England, and it sucks up here during Christmas. I ran 4 miles, and my dad had told me, he's like, yeah, just call me, I'll come pick you up. He's like, oh, we went to lunch, so like, just call me when you get back. And I was 4.5 miles out. I was like, I guess I'm running 9 miles hungover today. So I did it, and I was like, well, if I can do this, I might as well sign up for a half and do it. And then once I signed up for it, I was like, all right, like I just want to do it. And then, it was like, I think I could do this like sub 9-minute mile, like average pace. And I was like, I might be able to do sub 8:30. And I was like, oh, I can definitely do sub 8:30. Then I got to sub 8, and I was like, oh. And then I didn't run for like 6 months after that. And but now like I went back out and like after like 2 runs,
still got it. Yeah, still got it.
So if you just took some time to develop the base and then like go out, now it's like, now that I'm not doing it competitively, it's like, 45 minutes of zone 2 out there, like no problem. Easy.
I love that. I love that. That's one of like the biggest, like, I don't do it at all, but I've worked with a lot of endurance people, and the people who I asked to go to the gym to check the box of like, oh, do 30 minutes of, moderate intensity aerobic exercise. Nobody wants to do it. People will do it for a couple of weeks, but nobody does it regularly. When you get people into like that whole scene and culture of the races, what I love about it is that people, when you see that you're getting better, it just breeds confidence. It shows you that the body can change, and you're not stuck, and then you're not helpless to like, and it's not impossible. And like, if you can like build that up in someone the way you just described, like it kind of like builds momentum, and it takes life of its own. Like I love seeing that in people, and I see them like, they got a little swagger now when they walk around, because they see that, they're in control, and that they can make things better, and it starts spilling over into other parts of their life. And then it's great, and it's a great way to like, when it's objective, like like the race times, it's less about feelings. Like I hate the part of fitness and like rehab that's like, oh, this is what I feel, and like I totally want to understand how you feel, but like sometimes some things need to be a little more objective, and then it kind of steers them away from like all the nonsense that people are selling. And so I love that you described that, and I love that you have that in you, and I'm still not going to do it.
It was worth a shot.
Not that you're trying to convince me, but like, no. I watch people do that, and I think it's so great,
After I did the half, though, I was like, I'm never doing this again. This sucked.
Yeah.
To be uncomfortable for 2 hours, I did mine like an hour and 44 minutes, but it was like, it was brutal. It was awful. I'm not a runner. I'm 5'9" with pretty thick, meaty legs, and even like I was in the corral, and some guy looked at me. He goes, "This is your first time doing this?" I was like, "Yeah, how'd you know?" He's like, "You don't look like a runner at all." He's like, "You're not built like one." I was like, "No, but we're gonna try."
Man, that's even more impressive, man. Like I love that. That's another thing with running that I think is super cool, is that you're constantly fighting yourself. Your mind is saying like, "Oh, just stop. You can stop. This is far enough." And then you're like, "Oh, this hurts. This is not fun." And I think I want to stop. And then you're like, "Oh, just let me see." And then you realize that every ache and pain you feel isn't dangerous. And you start learning how to decipher what's helpful pain from hurtful pain or dangerous pain. And you learn to be really uncomfortable and not have to like feel like you got to get fixed or something, which is great. But it also leads to a lot of people who like don't know what is dangerous pain too, I guess, and they run through all the red lights and yellow lights and stop signs.
Let's talk about that for a minute. Yeah. Helpful versus hurtful pain.
Yeah.
How would you educate someone on how to differentiate what's what?
Yeah, I mean, let me preface this first with like, this is not medical advice, and like, there's a lot of like really serious medical situations. So this is not for all situations. This is all like if we've ruled out like serious things. But like, if you feel a little bit of pain, like, there's a traffic light system where it's like 1 to 3 is green, 4 to 6 is yellow, and 7 to 10 is red. And that's a general idea that's basically telling people that feeling some pain is okay. But for me, what's helpful versus hurtful is what unfolds over time. So if you feel something that's short-lived pain, but next week I can objectively show you that you're stronger or faster or more mobile or better from it, but the pain didn't interfere with your life, and it didn't derail the program, but and it was very short lived, then I'll take that trade off. Like, I prefer it not to be painful, but like, like if someone gets a knee surgery, whether they're in pain or not, what are they going to do? We're going to make them walk. We're going to make them do range of motion. We're going to make them do strength training. Why? Because in the long run, that pain will go away. But if you don't do that, your long-term outcomes are going to be worse. And to me, that's the analogy that people need to understand, is that if I know it's not dangerous, if it's not going to make things worse in the long term, but it will make you better in the long term, then I'll take that trade-off. And I'll try to make it more comfortable for you next time. But I'm not afraid of leading you, guiding you, supporting you through things that feel scary and dangerous, as long as I'm sure that I'm tracking your baselines, that you are not opinionally getting better, but actually measurably getting better.
Yeah.
Does that make sense?
Yeah. Absolutely.
I know you know that.
Yeah. I think for a lot of people, it's like, especially like runners are a big one too, where it's like, yeah, you can deal with this pain. That's great. Now you're in my office because the pain has gotten so bad. It hasn't stopped you from running, right? But it hasn't gotten better. It's probably gotten worse. Now our gait is changing because of it. We're compensating more, doing other things. Now I'm feeling aches and boo-boos in other areas, maybe because of that initial source. So I think it's, knowing what the pain is, where it is, but how much too of that we can sustain, what duration, what intensity, what time. Like, those are the variables that we need to measure. And because we can measure it, we can manage it, right? It's like, okay, back to the deadlifting or the running, right? It's like, okay, it wasn't the deadlift itself. Like, that movement didn't hurt you. It was, you got to a certain weight, a certain intensity, your overall accumulated stress from the week did it. Right. I got to look at all these things. So,
complicated.
Yeah. And so, like, I have rehabbing a professional ultra marathoner right now. And he's gearing up for 100-mile race. And like, I love working with them because it's such a challenge almost to manage that amount of volume. And like, the dude runs like 120 miles a week. And he's actually coming on my podcast too to talk about some of this stuff. His name's Ryan Montgomery. But he just runs an insane amount every week. And it's like, for most people, they're not that prepared to do that as he is. It's like, his tissue's still good, but it's like, all right, dude, like, if you feel pain the moment your foot hits the ground through the entire race, and then it's worse after for 3 days, like, maybe we should, cut it down to, I don't know, 80 miles a week or something for a little bit of time. Start there, see what happens. If it's better, okay, let's keep there. Then let's add back in. But they don't want to do that. They're just like, fix me.
Yeah, I mean, listen, like, I'm always impressed by those people. We have not to play the like, the one-up game or anything, but we have a guy in the gym who just ran a 300-miler in Arizona. He's first of 200 people to run that kind of race. And I'm like, you're crazy. And I love learning from these people because they've sorted out what is bad pain from good pain. So I ask them in their words, and I always learn from them because I know clinically,
Yeah.
But I'm like, how do you describe it, right? And I think that's the language that I use. He said that if he knows it's not going to get worse, then he's fine running through it. But if it's going to become something that's going to stop him from training, or he's going to have to, that's going to ultimately cause him to do less over time, then he knows he has to back off.
Yeah.
And I like that because, like a bone stress injury, right? If we think something is like something is in a catabolic state, something that's breaking down instead of building up, because the exercise itself, runners, the best part about, I love talking about runners because, like, in the gym, we think we have to do 10 exercises, but runners just do one. They just run. So you don't have to worry about all these variables. I'm like, oh, you don't have enough pulls versus your pushes. It's like, no, you don't have to pick what exercise. You just change the other variables. Anyway, like, Runners will, if they're developing a bone stress injury, like we're not going to treat that as like, oh, it just hurts a little, like, oh, I can still, like, I'm fine because of this. Like, no, like if I think your bone's going to break because of what you're doing, like I'm going to stop you. Like that's irresponsible. But like they're not qualified to decide, because sometimes like if in the pain it was in the past was a similar level, because the only thing that people want to ask them is like 0 to 10, how much pain is there, and they think that's the main decider. But it's like, no, I have to track this over time, like and if like each time you go out and now it's more and more painful with easier and easier things, like that to me is a big no. And then you have a lot of these physical therapists and trainers who are like, oh, let me look at your running gaits. Like my gait's been same the whole time. This has never happened before. And they want to look at that, and nobody's asking them how much they're sleeping and eating and these things. And like they're trying to K-tape it and massage it out. I'm like, you guys are not understanding that this is not about like picking some easy thing. Like you got to stop somebody from doing that. And you know, that's what I mean by dangerous pain from not dangerous pain. Like I think we jump to conclusions if we don't talk about how much someone's eating. Like, because a lot of people who run, like they want to be skinny, and that's fine until you take it too far, right? Once like getting a hobby of running to be running to be skinny meshes with getting into the high of chasing like PRs and races, that becomes a dangerous thing when they don't realize that like you got to fuel up in order to be able to run those kinds of distances, and then that kind of thing happens.
We had a high level girl get hospitalized. She was a high schooler, and it was just long distance runner, and she was getting looked at by some like D1 schools and stuff, and it was like be lighter. And just random, and she was doing pretty good in the gym, and then one day I just got a call. I was like, yeah, so and so's been in the hospital because we were like, where is she? I was like, yeah, she's been in the hospital for 3 weeks. They called it. They ended up just marking it up as REDS, which is like a just like an energy deficiency, like not like disordered eating, but just for the amount she's running and not eating enough, which like for most people, I hate these norms we give of just like, everyone should eat like 2,000 calories a day, where there was like, well, not if you're burning like 1,500 just on a run. Like you can't survive. You literally break down.
Yeah, I mean, I asked those runners. I asked the female runners if they have regular cycles, menstruation cycles, because that's one of the signs of REDS. And I think people appreciate it, even if it's personal. And I'm a male, but it's just part of doing our job, right? We got to look at all the signs, and it goes back to that thing we were complaining about. Like a lot of people, they just skip steps, or if we let people interpret what we mean instead of giving the context and the nuance and unpacking with them, like they'll take one idea and they take it way too far. They're like 1,500 calories. That's the number. Like everybody all the time. Like it was well intentioned, but like everything requires context. And so. I'll until like I'll probably never. I'll die in that hill. Like everything's complex. Like I'm not gonna oversimplify it if it's not simple.
It's our job to make it simple for the people, but it's something people come in all the time and they're like, or I love like I'll be out at a bar or something. Someone's like, oh, can you tell me what's wrong with my elbow? I'm like, no, dude, I can't. I'm like, literally, people come to my office and pay me to spend an hour with me to figure that out. And I'm not doing that here. Yeah, it's like, it's not that simple. There's so many things. It's like, well, what do you think it could be? It's like, I don't fucking know. It's like, it could be nerve, it could be muscle, it could be joint, it could be your like centrally sensitized brain. I don't know. Like, what is your past history? What are your mommy and daddy issues? There's so many different things that go into it. It's so complex. Yeah. And then we have to dial it down and figure out from all of that what is important for this person. But it's just funny what people can think of it, and all the systems that go into it.
Yeah, I mean, it's the world that people are being sold. Like, I always try to think of it from their side, and like, people are selling these things, man. Like 3 best exercises, like lose weight in 6 weeks, like just get this surgery and you'll feel better. Like, everyone's kind of BSing the situation. You know what I mean? Like, Nobody is immune to that, meaning like every professional is doing it. Physical therapists do it, trainers do it. I'm both of those things. And so, I don't blame people for ending up thinking that way, but then, man, I get frustrated. And so that's why we don't chase people. I don't try to before we got on, we were talking about how we built our businesses, and I'm all word of mouth. I'm not trying to go out there and compete with Barry's boot camp or the big hospital over here, trying to capture every single training or fitness client, training client, or rehab client. I'm only working with the people who really, really are ready to do an investigation and a deep dive into this stuff, because if I'm going to do it, I'm going to do it the right way. And if it was going to get better with something really simple and easy, you probably shouldn't be coming to us in the first place. It would have gotten better anyway. So, we're here and we're ready to work with people who need that, but I'm not trying to chase you down and convince you to work with me. You know what I mean?
Yeah, exactly.
I'm playing hard to get.
Yeah, definitely. Same. Everyone wants to work with me now. I'm like, nope, I'm going to see the other guy. Anyways, Ryan, anything else you wanted to add before we wrap this thing up here?
Oh, man. No, I think just reiterating, being healthy is multidimensional. It's physical activity guidelines. People who know about good training are probably good rehab specialists. People who know about good rehab are probably great trainers. And I know that you guys do good work at Architect, and hopefully this is helpful to people. And hopefully we're inspiring people to move. And that's my best bet on being healthy.
Yeah. And Ryan, if people wanted to come to you for some fitness or some rehab, or just check out your, you guys got some pretty good social media up there too, but where can people find you guys?
Our website is reloadpt.com. We're in New York, and our Instagram is @reload.pt, and hopefully we share some good nuggets there. My personal is @dr.ryanchow. That's dr.ryanchow.
Nice. Well, Ryan, thank you for coming on today, and hope everyone enjoys this podcast. Thanks for listening.
84% of you that listen to this podcast frequently do not hit the follow button. If you've enjoyed any of these episodes, could you do us a favor and hit the follow button, leave a rating, and maybe leave us a review? It helps this channel more than you know, and the bigger the channel gets, the bigger the guests get. If you'd like to know more about training in person or online with Brett's Gym, Architect Fitness, please follow us on social at ARKITECT Fitness on Instagram, or visit ARKITECTFitness.com. Or if you want to rehab with Barbell Therapy online or in person, check out @barbell.therapy or visit barbelltherapyandperformance.com. Thank you for taking the time to listen.